Okay, I believe that was very elaborate, and I'm not going to again retranslate it in English. Yeah. They have understood. That is for the ones who are very familiar with Arabic more than English. Um, we were still talking about the benefits. I mean, the success stories. Yeah, the very important success stories. Yeah, because it's very important. So you can give us that.
So I'm glad to say you that many hundred of patients we have treated exclusively from South Sudan, and I'm very happy to say till now 99% people came back. We are very happy and had a good treatment, remarkable treatment, and why they are happy. This is not only from my side or hospital side. It's also depend on the people. So in my 10 years of experience, I am very free to say this, that I have treated plenty of patients from South Sudan, and this is my personal experience. The people of South Sudan, they are so nice, means very humble, very kind. They never fight. If we do something for them, they really become happy. Means they appreciate that. This is another region in our success story, that when a patient from South Sudan they come to India, they literally they don't only say it, but they meet us just like a family, and they help us to serve them as well. So that's why they become more happy. And I'm glad to say that I am dealing with the people of South Sudan who are really very smiling face people, and always they supported me also. Never they fighted me with me for any single reason. This is my personal experience from South Sudan. So I really appreciate. If we talk about the success stories of them, so as I mentioned, we have done very critical cases from South Sudan, like infected leg amputation, prosthesis. We have done kidney transplant from patients of South Sudan. We have done liver transplant from here. We have done, I think, exclusively I took done more than 300 spine surgeries patient we have treated from South Sudan. We have treated more than 50 patients for the neurosurgery, brain surgery, means the craniotomy and excision of removal, tumor and the meningiomas cases. So we have done. So rest of the other specializations also we have covered.
Yeah.
And so this is a very good success story. To testify those success story, I can promise you one thing, that I can give you the contact number of the patients and the name, but to my viewers and in the public, I'm really sorry that I cannot take any name of the patient, because healthcare and the treatment is the personal thing for the patient, which I cannot take their names or anything on air, because this violate the law of the privacy. Okay, so but yeah, for if you can testify with them, I can share you in private. You can call, and if they will be ready, you can take their interview. I will be happy if they can say. Yeah.
Actually, we would really love to have an interview maybe at a later point with the patients. They also tell us
Right.
how they have enjoyed the treatment. Yes, we have so far come to the evening of the program.
Okay.
Yes, but before we conclude, Arab Medical Care
Yes.
is in conjunction with the Fortis Hospital.
Yes.
Yes, but we have not known much about Fortis Hospital.
Okay.
Yeah.
So now I will let you know about the Fortis Hospital.
Yes.
Fortis Hospital is one of the largest group chain hospital in India, and their branches are not only in Delhi and India. In India, they have different units in different cities. Okay, plus in other part of the world also they have a lot of hospitals. So this is one of the finest and biggest group of India in healthcare system. Okay,
Yes.
if we talk about Fortis Hospital, this is the hospital who have each and every specialization from top to bottom for each and every treatment. All the facilities are completely available, and at different units we can help the patient at the most affordable cost as well. Okay, if we talk about the Fortis Hospital, they have their specialization in such a manner that if a patient is going for the bone marrow transplant, and patient if the patient is a child, so they will be referred to the pediatric bone marrow, and adult will be moved to the adult bone marrow transplant.
Okay.
Doctor, so for each and every specialization they have a separate doctors for the pediatrics to deal with them, and adult different. So this is the most important thing, that when a pediatric surgeon is treating the child, the outcome is much better rather than if the normal surgeon treat that.
Yes.
So if we talk about the particular specialization, so Fortis is very cautious on that part, that if they choose the specialization as per the patient age group and give the doctors as per that their requirement.
Okay.
Another thing that we are working with a lot of hospitals also, but we got this opportunity with Fortis Hospital.
Yes.
Because Fortis Hospital also believes in the CSR, that is corporate social responsibilities,
Yes.
and the group is big and they are expanding a lot. So within their expansion of the hospital, we proposed them that you should come with us to South Sudan.
Okay.
People really need to see the doctors,
Yes,
and
yes.
many patients who cannot directly afford to come to India. So you must come with us, help them, and see the patients. If something can be manageable in South Sudan, we can suggest them to get. So if they are not getting the proper treatment plan, and they are just avoiding their problems, so it is better that we can see them and suggest to at least maintain the good quality of health. Okay, and yeah,
Yes.
so
That is quite very elaborate.
yeah, so we are going to also conduct the free OPD camp at the Juba. Yeah.
I was actually coming.
Oh, that's great.
Yes, we are going to be on 11th and 12th, right?
Yes. Yes.
11th and 12th.
Yeah.
Which is very soon now.
Yes.
There is going to be a free medical surgical camp.
No surgical. This is a medical camp only.
It's a free
Medical camp.
camp.
Yes.
Okay. So I think this is now where you're going to explain to the viewers what this is all about.
Yes.
Yes, you can explain to the viewers exactly what.
Yes. So this OPD, this free OPD is at Juba Teaching Hospital.
Yes.
First of all, I would like to extend a big thanks to Ministry of Health South Sudan,
Okay.
to Honorable Under Secretary of Ministry of Health South Sudan, and also Juba Teaching Hospital, who has given this permission at their premises to conduct this, and all the licenses and permissions to the doctors. So the purpose at this event is free OPD consultation for the patient who are having very specific problem related to the brain. If patient is having a lot of epilepsy cases, they are getting the seizures, they are having any tumor in the brain, or many of the child, sometimes the brain is becoming large and the water is accumulated, that is also known as the encephalitis. So brain related all kind of the issues the patient have. For those patients, we have our doctor, Dr. Anurag Gupta, who is from Fortis Hospital, New Delhi. He is the director of the neurosurgery and a most experienced neurosurgeon. So they can see the doctor also. Another doctor, we have Dr. Dhananjay Gupta, who is expert of the joint replacement, orthopedics, and spine surgeries. Okay, so those patients who have any problem related to bone inside the body, any bone fracture, tibia, fibula, or they have joint pain, arthritis, or any trauma is there, old disease in the bones, or old fracture or something, those kind of the patient, and the patient who is having any kind of the back pain in their body, and having the cervical pain, having any kind of the lumbar pain, or they have feeling in at the initial stage they are feeling in the numbness in their hands. This might be a symptom to know that you are having the spine problem. So if you have some numbness in the fingers tips, and you are your lower and upper limbs are becoming weak, or you are problem in facing a problem to stand for a long time or sit for a long time or something. So if you are facing such problems, that means you must consult for the you must consult, even not now, but you must consult the new spine surgeon for these symptoms. So this is good. Unfortunately, now our spine orthopedic surgeon is also available on 11th and 12th at Juba Teaching Hospital. So if those people have such kind of the problem, please consult.
Yeah.
One request we have from our viewers, that whoever want to come to us in the hospital, make it please valuable. That means please bring all your medical reports and existing treatment plan, what you are availing.
Yeah.
So it will be much better to get an idea from your reports to add, and then our doctor will be in the position to advise much better.
All right, thank you. And that brings us to the end of our discussion for tonight. Maybe just let me give you a chance. Let me start with Joseph Silvio.
Okay.
Just say your last word to the viewers before we go to Kishore. Say his last word.
Okay,
In just a minute.
thank you so much.
Yes.
My last message to the
Yes.
audience who are outside there.
Yes.
If you are facing this kind of problem, we have shared with you, so please try to contact us. We started the registration yesterday, and today.
Tell us where they can find you also. It's very important.
Okay.
Both online and physically.
Okay, online, so you can get us. We have the number I'm going to give you now, which is +211 922 10 1598. This is the number where you can contact and get us even online. Okay.
Yeah.
And then the same time you can come to Juba Teaching Hospital. You will find us immediately in Juba Teaching Hospital. So where you can book for, you can come and register yourself, your name, and then we can give you an appointment for Monday. أنا بس في أترجم العربي البسيط.
Okay. Good.
للمستمعين اللي إنه عايز يجي عنده مشكلة في السلسلة الأخيرة بتاعه، عنده مشكلة في الرأس أو مشكلة في النظام، فعايز يقابل دكاترة طالعين. فبنطلب منك إنه تعال قابلنا في مستشفى جوبا، يلا بينا تسجيل مباري والليلة، تعال قابلنا في مستشفى جوبا مباشرة نقدر شنو نساعدك. عشان عايز نلقى الأرقام بتاعنا عشان ترسل الرقم بتاعنا بالصفر 9 22 10 15 8 9 نقدر نتصل لكم مباشرة قدامنا ونقدر نوصل كيف تجي عشان نتقابل معك. شكرا.
Okay, thank you. Before we come to you,
Yes.
I'm seeing there are some comments coming
Okay.
from Facebook
Wow.
that I think is very important that we really go through these comments very quickly.
Yes.
Number one, I am seeing Bachom Abuk Piol. She's asking how about transplant. Tell us how one can arrange for that. I think they will have to come to Juba Teaching Hospital on 11th and 12th. They will get more information on that, on transplant.
So I want to just know about that. What kind of transplant they want to know about, because we have several kind of the transplant. And we have liver transplant for patients is having the liver problem, or they have a kidney problem, or they have a hemato problem. So on the basis, we can decide that the patient can come for the transplant purpose discussion.
Yeah.
So I need to know that they are talking about the liver, kidney, or bone marrow.
It's okay. I think these patients or these people who are questioning, they will come to Juba Teaching Hospital and get more information. Someone is asking how much does it cost altogether. I think issues of cost they can also handle from there. Wekatak is saying how affordable are the treatment and why is it not brought to Juba to cut the cost of traveling. I think this is a step by bringing it to Juba Teaching Hospital.
Yes.
Is the beginning,
Yes,
right?
this is the first step where we
Yes.
are initiating the process.
Okay.
So I know that this is a very frequent question everywhere and from everyone that why not you are bringing the facility to Juba and rather than the patient is traveling to India.
Yeah.
I totally respect your proposals, and definitely it is under the consideration.
Yes.
So now this is our first step when we came for the OPD with the collaboration of Fortis Hospital.
Yes.
So first, this is our first step. Second step will be that very soon when I'll discuss more about the ministries of the health and their permissions.
Yes.
And if we get some operation theaters and nosocomial infection-free kind of theaters.
Yes.
Nosocomial infection is known as the acquired hospital infection. Okay, hospital acquired infection is known as that. So post surgery and post surgical care, this is very important to avoid any kind of the infection. Otherwise, the surgery will be useless.
Okay.
So we will work on that with the government of South Sudan. Also, we will go and request them to work on that with us.
Yeah.
And if it will be possible, we will surely come for the surgical camps very, very soon.
Yes.
Okay, so when, yeah.
Now, lastly, does it mean I will have this from Alero Mara, still on Facebook, the last one?
Yeah.
Does it mean I will have to pay for the other services and have to travel for treatment to India? But I think this was already handled in the discussion. Yes. And I would like to say thank you very much for our viewers who are trying to reach out to us on Facebook, and they're trying to give their comments. We really appreciate you very much for sending in your comments and questions. For more information, you'll have to come to Juba Teaching Hospital on 11th and 12th of March 2024, and you come and get help. Bring your friends, bring your relatives, bring your mother, your father, your grandfather, your grandmother, and everyone who may be having this condition. Our time is up. Our time is really, really up. I don't know whether you really have something very burning or we just conclude.
Yeah, you can. I think we have covered most of the topics.
Yes.
So last comment I can just say, don't worry. In India, Aarav Medicare is your family.
Yes.
So if you plan for the treatment, travel, or anything, just feel free to contact Mr. Silvio, or you may contact me directly in India. I assure you with the most personalized care of service, customized treatment package, and with the ethical practice, you will be taken care of by Aarav Medicare.
Thank you.
Thank you.
Thank you.
Thank you, viewers.
Yes.
Namaste.
Thank you. Thank you very much. And that concludes our episode of the Business Focus. Catch us again next week, same time, same place. Juba Echo TV. Edward Owachgi, your host, the Business Focus. Thank you.